Good, excellent. Thank you very much, Vaughan. Yes, I'm going to talk about the Quick study, which is a study that is looking to be able to measure the impact of chronic pain on the engagement in paid work and develop a new questionnaire for doing that. So I've been involved in the first phase of this, which is the systematic literature review, which I'll talk about. It's not a long presentation, just so you know. I gave this a couple of weeks ago at the Royal Society for Rheumatologists, so there was a time limitation on it. But I think it's a really interesting study. So the work was funded by the MRC and Versus Arthritis, and the project's held within the Centre for Musculoskeletal Health and Work. And as you probably gathered, I'm part of the occupational health research team here at Guy's and St Thomas's. So I work with Ira and Vaughan. And we're associated with King's College London as well, and we work in collaboration with the centre. So for a bit of background on the study, we know that chronic pain has the potential to impact the ability of people to engage in paid employment. And although there are some questionnaires that measure, for instance, productivity and working hours and number of days absentee of sick leave, there's no standard questionnaire that captures all the key impacts within the workplace for both the employer and the employee. And also that might include psychological impacts, so aspects that might then impact productivity in the workplace. And then also current questionnaires, they're not really so appropriate for current ways of working in this modern day gig economy. For instance, here at Guy's and St Thomas's, a lot of staff work on shift work. And then, as you all know, as a result of the pandemic, many of us are working more flexible working practices with more working from home. So we need a questionnaire that is applicable to all different work settings. So the overall aim of the Quick study is to explore how chronic pain at work is currently being measured, how it can be improved to understand that, and then to develop a new questionnaire that assesses the key impacts for both the employer and the employee. So just giving you an overview of the whole Quick study, and I'll put my literature review in context of this because it'll just show how it all works together. So it's divided up into these 5 main areas, and my literature review was just at the very beginning stage of this. So in order to understand this impact of chronic pain on being able to engage in work from the literature side, we looked at both quantitative studies, so that's existing questionnaires, looking at the impact of pain on work that's actually measured. And then we also looked in literature at qualitative studies, so interviews, looking at how people describe that impact. And then we mapped the qualitative onto the quantitative, and we could see what was being measured out of those qualitative studies. And then also we were able to then identify where the gaps lay in what people were saying, how they were impacted, but what was not actually being measured. And then we were able to pass all these results on to the Quick study team, who then use this information for their focus groups. So for the scope of this literature review, we looked at literature published between 2010 and July 2021 in working age adults, and they had to either be employed, or if they had dropped out of work because of their chronic pain, they had to be intending to return to work. So for example, in return to work studies. And they had to have chronic pain, at least at baseline in intervention studies or longitudinal studies. And the pain status had to be measured and not inferred by the presence of a known painful condition. So also not as a result of injuries or in situations where the pain was likely to recover. And chronic pain was defined as pain that persists or reoccurs for at least 3 months or 12 weeks. And this is the ICD-11 current definition of chronic pain. So the quantitative studies, they had to focus on that impact between chronic pain and employment. So if there were papers where they just noted work status and that was all, we didn't include those particular studies. And then in the qualitative papers, again, they had to be looking at descriptions of how chronic pain impacts people who are either in employment or want to engage in employment. So it could be retrospective. So we looked across 4 different databases and the usual thing, we looked at systematic reviews and other reference lists, and then we also consulted experts in the field. And as a result of the initial search, after excluding all the records, to our slight horror, we discovered there were over 6,000 references there. At this point, the quick study could have been renamed the not so quick study. However, we had a most amazing study team who then assisted and helped with the screening of many, many papers, not just abstracts, but full text as well, for which I'm extremely grateful. And we ended up with 46 quantitative studies and 16 qualitative studies. And then this is particularly of interest to the rheumatologists at this conference I presented at. The biggest group with pain had musculoskeletal conditions that were painful, and it was 74% in the quantitative studies. And within this group of conditions, the largest group again was chronic lower back pain, which was 40% of those. And then in the qualitative studies, we had 56% had musculoskeletal conditions, and half of those had chronic lower back pain. So the results of both the quant and the qual studies, we were able to divide these up into 5 main themes. So, and there were sub-themes within these themes. So I won't go through them all in minute detail, but first we had changes to work and to working status. So that's like reducing your working hours because you're paid, or having to go full-time to part-time, so your job status changes. And then you've got the productivity changes. So presenteeism, your productivity at work, and then absenteeism or sick leave. And then we've got here aspects of the workplace and work relationships. So really important for this questionnaire. So this was around support from employers and the individual having job control. And then we also had pain and symptoms, the impact of those directly. So we had this in 2 ways. So the pain impacting the ability to work through, for instance, chronic fatigue. And then the other way round, so instances where work can aggravate the pain. And then we had a lot of sub-themes around psychological factors, again, very important. And there were the more negative barriers, so emotional exhaustion, cognitive difficulties, and fear avoidance. But there are also some positive ones, for instance, having self-efficacy and having a positive attitude towards work. And then finally, there were factors outside the actual workplace environment, which could support that engagement in work. So, for instance, support from friends and family, and also healthcare services. And then other agencies who might liaise directly with the employer, just helping that adjustments to work and helping with return to work. So then across all these themes and sub-themes, if we look just at the sub-themes that we found in the quantitative studies, it was quite interesting that it was very obvious that there was a high focus on these impacts related to the quantity and quality of work. So this is around productivity. So measuring, for instance, reduction in at work productivity or presenteeism, and then measuring the number of sick days or absenteeism, and then the percentage reduction in workability. So it's factors like that, and factors that can then be linked into economic impacts of work. Whereas at the other extreme, there was hardly anything on self-efficacy and this aspect of support and having job control. So then if we look at these exact same sub-themes that we could map our qualitative studies onto, we saw a completely different distribution. So much less on productivity, and this was more about the impact of chronic pain on someone's ability to engage in work and what happens to them. So for instance, changes in employment, so having to adjust your job, for instance, reduce your working hours, or having to change your job, or even losing your job, that was what was important to participants. And then you've also got these aspects of having self-efficacy and the support from your employer and your colleagues. So with self-efficacy, it's in relation to an individual with chronic pain, having that ability to say, okay, I'm in chronic pain. I know what I need to do in order to engage in work, and then having the support from the employer to implement those changes and actually engage in work. So basically having some job control and support from your employer. So then finally, we look at the areas that are not being measured. So the ones that came up in these QALY studies that were unique. There were a lot of unique codes to that list on the right-hand side, but there were also some completely unique sub-themes. For instance, on the left-hand side, the top 3 and the bottom 1 are completely new sub-themes. And again, I won't go through all of these in absolute detail, but you can see there's more of a focus on those psychological factors, the benefits and the facilitators of engaging in employment. I'm just going to talk you through the last 3, and I'll explain in a couple of slides why. But there were issues with disclosure that came up. So employees not wanting to tell their employers that they were suffering from chronic pain and it was difficult at work. And this was around not wanting to be seen in the sick role. I mean, obviously there's problems with this because then you can't actually make any adjustments to work. And participants were saying they just went home completely exhausted and had to rest and recover in time to get back to work the next day and repeat the whole thing all over again. And then you've got the fluctuating nature of pain. So it's worse at other times than sometimes it's a lot better. So you might need adjustments at particular times, but not always. And this ties in with it being it's a very lonely situation to be in when it's a hidden disability. You can't see it, and also, you know, do people believe you? There were people expressing that their employers didn't believe them. If sometimes they're okay and sometimes they're not. So that was a difficulty there. And then we've got the economic consequences. So for those people who had to reduce their working hours, so that impacted their income, their household income, which was a very negative factor, and also other longer term economic consequences. For instance, the impact on pensions. So then we passed all our results back to the quick study team, who then used these results with their focus groups. And they've now drafted the initial questionnaire. So they've got 10 areas that they identified were indeed important from not only our results from the focus groups. So these are the areas they have put their questions around. So for us, it was really interesting, and well, it was good to see that some of the areas we identified did come up here and are in the questionnaire. So this issue of disclosure and also of fluctuating pain, and then of the economic consequences. So these were the 3 that I've just explained to you. So I just wanted to point those out. And you'll also see there in these areas about being a hidden disability and also being believed are being flagged up as well, and part of that questionnaire. So just to bring up to speed with where they are at the moment with this, the questionnaire development, it's at the moment within the Delphi study. So it has gone out to a whole range of stakeholders who have looked at the questions in the draft questionnaire and judged them for relevance for measuring that impact of chronic pain, and also looked at the response items and also the recall periods. They've fed back now, that finished on Friday, And the draft questionnaire will be adjusted, and then they'll be doing a second round. And then after that, they will then be ready to test the questionnaire. So that's my part of the study, and I have to acknowledge this amazing quick study team. Yeah, everyone who helped me. Particular thanks, I have to say, to Ira Madan, our professor here at Guy's and St Thomas's, and to Dr. LaChrista Morton, who helped with that original screening of over 6,000 titles and abstracts. It was no mean feat, so that was greatly appreciated. And then also just to acknowledge again the MRCM versus Arthritis who funded the study, and the Centre for Musculoskeletal Health and Work, for that opportunity just to be involved in this really interesting study. So that's it. I don't know if anyone who's here listening works in chronic pain or has any comments at all or questions, but it be interesting to hear back. Thanks.
Thank you, Anne. That was an excellent presentation, very clear and concise, so well done. Any questions from the group? I have a question, Anne, if you don't mind. Oh. You mentioned that over 50% of people report MSK-related reasons for their chronic pain.
Yeah.
How many people also reported mental health related conditions?
Well, that's really interesting, Vaughan, actually.
Because you sorry, go on.
No, well, it's an area that actually hasn't been included. And I think it's really important, actually, when we come to interventions, to actually include some mental health conditions. So it wasn't something we were screening for. And obviously it was an extensive process, yeah. But we were not measuring mental health conditions. But I'm very aware, and this did, come up in conversations at the rheumatology conference on the prevalence of mental health difficulties linked to having chronic pain.
Yeah, because your qualitative studies pointed to a range of different emotional and psychological responses in terms of managing pain and the impact on work and so on and so forth. Yeah. Catherine. Morning. Welcome.
Good morning. Thank you. Just a quick question about your inclusion criteria. I'm a clinician. I come from a physiotherapy background, and I see a lot of people with pain conditions, but a lot of those are not actually diagnosed or don't actually have some kind of formal diagnosis alongside them. Am I correct that you've excluded those, or did I catch on to that incorrectly?
Yeah, that's absolutely right. They had to have a pain measure saying, and also confirmation that they had had that pain for more than 3 months. So that was absolutely key. Yeah. As you know, pain can come and go, and somebody might have chronic pain for 6 weeks and then it's gone. But this was long term, just because we're looking at the impact on employment, and that is long term. So.
Yeah. I guess my comment is around the idea that I see a lot of people with very long-term chronic pain conditions that will never get a diagnosis.
Yeah.
But, I understand the intricacies and difficulties with that.
Yeah, well, I mean, hopefully what will come out of having this questionnaire is that it can be promoted, the importance of having a diagnosis of chronic pain, because I mean that's stage 1, isn't it? In getting it recognised by your employer.
Yeah, I mean, even if the condition itself is that the condition is some kind of functional pain condition that may never get a diagnosis, that in itself might be quite useful. Yes, because a lot of people seek a diagnosis and they don't get one because they're perhaps looking for something that is very defined, and often that just will not be the case.
I know, and it did come up in the QALY studies about people talking about, I'm just at the end of the road, because I hadn't had a diagnosis. And most of those had dropped out of work completely. But yeah.
Thank you.
Thanks, Rebecca. Okay.
Thanks, Catherine. Any other questions? No. Okay, well, And thank you very much once again for your presentation this afternoon. And thank you everyone for making the time to link in with this month's session. Just to give you a heads up on next month, Joe Yarker, who is our colleague from Birkbeck here in London, will be giving a presentation looking at the development of an integrated model of sustainable return to work following mental health related sickness absence. It's a project that her and her team have been leading on at Birkbeck. So I hope many, if not all of you, are able to join us next month. That will be on the 29th of June for your diaries. All right, thank you everyone.
Thank you. Thank you,